Let's get started. Hello, viewers, and thanks for joining our broadcast today. Today is a special day. What makes it special? You know why it's special? You know it. I know you all know it. It is special because we are celebrating all women in the world today, not only in the US. Because today, when I sent my, greetings to everybody on my WhatsApp platform, I received message saying that, is it America alone that celebrates, mothers and stuff? And I'm like, sorry, I celebrate all women in the world, not even only the mother, all women in the whole wide world. So happy Mother's Day to everybody, to the women, mothers, aunties, sisters, everybody that is called a woman. You are celebrated today. God bless you all. I'm Betty Oluwatosin Akinsola, aka Bofa, coming to you live on wellness and as well featuring experts to educate on health and wellness. Our guest today is a medical doctor, a medical researcher, and a lecturer in epidemiology and biostatistics at College of Medicine at University of Lagos, Nigeria. Dr. Tosin Akinsola. Dr. Tosin is also a regular guest on Channel TV, giving updates on public health. It's our guest on the program today, and he will be educating us on the latest on COVID-19 and as well educating us on other diseases, virus that we ignore because of COVID-19. So I want us to please pay attention to interview with experts. When we return, we are going to deal with this situation, and I want everybody to pay attention to that. At this time, we're going to go on break, and when we return, it's our head talk. Then we bring you interview with experts you've all been waiting for. So stay tuned.
Unhealthy eating habits have contributed to a lot of health problems epidemic today. Health problems like diabetes, high blood pressure, osteoporosis, arthritis, cancer, health disease, and so on. The good news is, if you can control what goes into your mouth and your body, you will live your best. For what you put into your mouth determines how well or sick you live. You and I know that poor diet is associated with major health risks that causes illness and even death. So, by making smart food choices today can help you protect yourself from all these health problems. Our integrative nutrition health specialist, Miss Betty Oluwatosin Akinsola, aka Bufa, wants to see you living your best without any health issues. She made this known in her program showing every Sunday on Healthy Living with Bufa TV. She tells us how our food choice affects our health and how we feel today, tomorrow, and in the future. If you are opting for optimal health, from fighting free radicals to living your way into a healthy and beautiful body, here are some things you must do. Eat a nutritious, healthy, balanced diet every day. Practice your daily exercise and take your supplements, especially vitamin D, vitamin C, zinc, and chlorophyll to boost your immune system against free radicals that cause cancer and other diseases. Join us on this program every Sunday, 1:30 p.m. US time, 7:30 p.m. African time, and 6:30 p.m. United Kingdom time, where she educates on health and nutrition as well as features professionals from various fields to sensitize you on wellness. See you there.
So let's just start with our interview with experts right now. Our guest is on the show at this time. So I guess we should just go straight there. Right now, we have on the program our father, our friend, our brother, all the way from Nigeria. Wow. Doctor, I want to say welcome on Healthy Living with Bofa. How are you
My
doing?
pleasure. I'm fine.
Before we move on, please give me a second to do the introduction, because I like to do that before we start. I'm sorry about this. I just have to do it. Our doctor is Dr. Akinsola Oluwatosin. Last name is Akinsola. So it's Dr. Tosin Akinsola is a lecturer in epidemiology and biostatistics at College of Medicine, University of Lagos, Nigeria. Dr. Akinsola has a BSc in statistics, Masters of Philosophy in Epidemiology and Biostatistics, and his PhD in Biostatistics, all at University of Ibadan, Nigeria. Dr. Akinsola is a member of numerous professional bodies such as Nigeria Statistical Association, Epidemiological Society of Nigeria, International Society for Clinical Biostatistics, and International Biometry Society. Dr. Akinsola is presently studying health and biomedical informatics at Northwestern University, Chicago, USA. Please, let's welcome a brilliant, smart lecturer, medical researcher, and data management consultant, Dr. Oluwatosin Akinsola. Doctor, again, welcome on Healthy Living with Bofa. How are you doing today again?
I'm fine.
Now, doctor, first, let me appreciate you for accepting to come on this show today to educate us. Now, many people said there's no COVID-19 in Nigeria because they don't trust the system, the government, how the situation is being handled. They don't trust it. They feel so disappointed to people's attitude towards this crisis. Doctor, as a regular monthly guest on TV on COVID-19, Channel TV precisely, tell us, how has it been in Nigeria on COVID-19? What do we need to know now? Because we all want to go back to our life, our normal life. We want to socialize, we want to party, we want to embark on a trip. Just tell us what we need to know. Go ahead and tell us.
Yes, thank you very much. Well, for over a year now, we've seen that COVID-19 has been on a global scale. And unfortunately, has affected the facets of our life in all ramifications, in terms of economy, in terms of education, in terms of social life, just to mention a few. But the fact still remains is that COVID-19 pandemic is still with us. And we just need to look at how we are still going to cope with it for the meantime. Though we are seeing some kind of spike in other countries, and in Nigeria too, though the situation I can liken it to, it's like in a remission now because it's going down. But notwithstanding, that doesn't give room for us to lose our guard. And the more important thing about COVID-19 is that recently too, in Nigeria, we had a vaccine that had been imported, AstraZeneca, that the health workers, the frontline workers, they are being given, and those who are at risk, that is those who are 70 years above. But the point I want to let us know about the vaccine is that most vaccine hesitancy, because many people, they hesitate to take this vaccine. vaccine are directly related to amount of negative press, conspiracy theories, and suspicion. And despite all this, we want to be rest assured that there's absolutely nothing new or germane about COVID-19 vaccine that we're having now, because we have real-world existing experiences on other vaccine. Like, this is not the first time we have had vaccine issue. We have flu vaccine, we have the one of DPT, the polio, tetanus, toxoid. So many of us, even when we are young, we have taken vaccine. So the same thing is also similar to COVID-19. Now, the point I also want to drag is that until there is sufficient herd immunity, to the point that most people are unlikely to have infection, the precaution that is the gold standard, that physical barrier to infection, social distancing, and hand washing must remain. Even when you take a vaccine, your body must take time to develop antibodies. And after the booster develop even more. But how long the immunity will last and whether it will be the same for all vaccines, only time will tell. But finally, concerning this vaccine, we need to have the confidence that those people who develop this vaccine, they need to be praised. And because for now, it's the vaccine that is the solution for us now. And I will encourage every one of us, if you have a opportunity to take COVID-19 vaccine, take it.
Wow. Wow. You see, I received some calls a few months or a few weeks ago. People asking me, should we take the vaccine? Shouldn't we do this? Shouldn't we do that? I tell them, even though I'm not a medical doctor, let's look at it in general. We have been taking vaccine for some viruses. There's no doubt about it. Nobody can say no to that. We have a vaccine for, even for flu shots. You can't just go and have one-on-one to a patient in this America without having flu shots vaccine. That alone should tell us that there's nothing different from taking vaccine for COVID-19. It's just the lots of negative information we are listening to on social media that scares people. You know, some people take this vaccine seriously. It is true, they get sick or something. It depends on your immune system. I tell them that. So without taking much of our time on that, it's all clear now that people, please take your vaccine. If it is time for you to take it, go ahead and take your vaccine. You can't beat it, because the time is coming, they will ask you if you have your vaccine or you don't have it. You must get your vaccine before you do certain things, especially in this America. A time is coming like that. So waiving that or ignoring it make no sense at this time. If you have opportunity to take it just like regular ordinary vaccine we've been taking in the past. There's nothing different. So it is very important we take this vaccine to protect ourselves. It's not that you will not get infected. It's just that it will protect your body. It will, you know, make your body immune against that vaccine. So you just have to take it. Thank you so much, Doctor. I really appreciate you for answering this. Now, we've done about the vaccine and the safety of it. I want you to tell us, what should we be sensitive to? Because we are all focusing on COVID-19 virus alone. And there are a lot of infections, viruses, diseases out there. If you want to tell us as epidemiologists, you want to tell us that the dangerous and deadly disease out there that we must or we should be sensitive to. Let's forget about COVID-19 now, because we can see that it's not the only COVID-19 that is killing people. Those that have underlying illness, conditions, they are the first people to get down on this virus. So now let's look at other things that we must be sensitive, we must be aware of around us? Please go ahead and tell us.
Yes, as a matter of fact, thank you very much. As a matter of fact, we have other infectious diseases apart from COVID-19 that we need to be cautious of. In fact, if I want to mention, there are lots of them, but I can just mention some of them, but I would dwell my time on one or two of them. We have, apart from COVID-19, we have the influenza, we have the HPV, human papillovirus, virus. We also have hepatitis. We have polio, we have rotavirus. But the one I want to shed more light on is hepatitis. Because hepatitis, some people they don't know that they have it, and they don't take some kind of observation or to go for checkup to know whether they actually have it. Now, hepatitis, when I'm talking about hepatitis, is an inflammation of the liver. The liver is a vital organ, and when it is inflamed or damaged, its functions can be affected, including the ability to process nutrients, filter the blood, fight infections. Besides that, hepatitis is commonly caused by viral infection, but the other possible causes, including heavy alcohol use, toxins, some medications, or certain medical conditions. Well, if you want to even do hepatitis, we have hepatitis A, B, C, D, E. But, like for example, in the US, the most common viral hepatitis in the US are the hepatitis A, hepatitis B, and hepatitis C. Although each of them has similar symptoms, they have different modes of transmission and can affect the liver differently.
Oh, doctor, I'm sorry to stop you. Are you saying that the common ones in the US is different from the one in Africa? If yes, which one is? Because we have our viewers, our audience, we have them all over the world. And now you're talking about the one that is common in the US. Can you tell us the one that is common in Africa, in Nigeria precisely, so that our people can be conscious of that? They can be, aware of what they should be very careful of. Because I realize that this hepatitis, you can contact it, you can get infected through kissing. And not everybody knows this. So I want you to tell us more on that, because we kiss and kiss and kiss, and people don't even know what is going on around them. So please go ahead, sir.
Yes. Well, though in US, as I mentioned, you also common hepatitis A, B, and C too. You can also find them in Africa, because just only in terms of some of the prevalence may just be different from region to region, and due to some other factors that can also give rise. But the one that is actually also common in Africa, we have hepatitis B and C, also very common in Africa, which we also have some kind of prevention, treatment, and the symptoms, their causes. So it varies. We also have some of it also in Africa, but it depends on some of the regions, maybe in the US or in Africa or in South Africa. But what we just want to know is that their symptoms, their causes, and we may need to focus on, if you would like me to dwell on that.
Yeah, I want, because of our time, you can tell us the symptoms. The symptoms. If people are having these symptoms, what should they be expecting? What does that tell them? I want you to talk about the symptom and how people should be very, very careful when they should be aware of that, because you never know who can infect one another. That's what I want you to talk about.
Okay, for hepatitis A, the symptoms, for example, for symptoms of hepatitis A, the children younger than age 6 years usually do not have the symptoms of hepatitis A. In other adults, in other children and adults, symptoms of hepatitis A may include fever, fatigue, loss of appetite, nausea, vomiting, abdominal pain, dark urine, diarrhea. That is for hepatitis A. Then for hepatitis B, the symptoms of hepatitis B vary by age. It can also be fever to fatigue, loss of appetite. Then for hepatitis C, we can have clay-colored bowel movements, abdominal pain, and sometimes fever for hepatitis C. Then for, I think those are the ones that are common for hepatitis, the symptoms of hepatitis A, B, and C. Then if you want to talk about their treatment, the treatment of hepatitis A can, you can give something like, well, the prevention is something of family and caregivers of adoptees from countries where hepatitis A are common. We can have immunization practices are recommended for who are predisposed to those conditions. That is, all children at 1 year of age, they need to be given immunization.
Oh, that's hepatitis. Yes, that I know. How should we be? Should we prevent ourselves? Prevention of that hepatitis.
Yes.
How should we be prevented from that? From getting infected from those who are already carrying the virus? Because we realize that today, if you have hepatitis. Mm-hmm.
I'm listening.
Yeah, if you have the hepatitis, you can contact to my own experience, to my own research, you can contact hepatitis through kissing. If you share, things that has fluid of the person on it, you can contact it. So is it true that through kissing, sharing spoons, sharing this that goes into the mouth of the infected person, someone can get infected?
Yes, for hepatitis A.
Okay, that's for hepatitis A, right?
Yes, one can get infected. Yes, but for hepatitis A, there are no specific medication or treatment for hepatitis A. The only thing about hepatitis A is that care is focused on maintaining comfort and adequate nutrition. That is for hepatitis A. Okay. Then for hepatitis B, the vaccination is the best way to prevent hepatitis B. And it is recommended that for hepatitis B vaccine is recommended for infants, older persons, and adolescents who are not previously vaccinated, and certain adults who may have sex partners that have hepatitis B, or any sexually active adult who is not in a long-term mutually monogamous relationship, or men who have sex contact with other men, or those with close household contact with an infected person.
Okay.
Then adults who share needles, syringe, and other drug injection equipment. So those are the prevention for hepatitis.
So we should be very careful in sharing things with people you don't know their medical history, especially husband and wife. Anyway, if you want to get married to anybody, you must have a thorough medical, examination before, like making sure you know the blood group, the genotype, and this test of hepatitis, and also HPV. It's also contacted through this sex with another partner. So that I know. So our people, you just heard about that. Be careful of who you deal with, who you share things with. It is very important we have this in the back of our mind. Doctor, now you have advised us on what to be aware of which I'm sure people, will try their best to keep to that, to be careful of. Now, let's talk about your, experience in data management. You work as data management and monitoring evaluation consultant to Federal Ministry of Health. Can you say to us today that Nigeria health data management is better now? But because before I leave home, before I relocated to this country, I know that there's nothing like that. You cannot even transmit. Even when I got here, about 6-7 years after I got here, I can't even get that to my head because I had a bad experience when it comes to that. So can you tell us, is Nigeria health data management is better now in terms of transmitting, health information? For instance, I'll give you an example. If a patient from Nigeria is transferred to US for treatment, and all his or medical history is in Nigerian hospital, how will that person get all his document, history, medical history, to the US, except if they transmit this thing electronically? But I don't think that is functioning in Nigeria, and that's what the data management is all about. Can you tell us, how is it now? Is it better than before, or we still have the same problem?
Thank you very much. Concerning data management system in Nigeria, I think the situation is still worrisome, and we still actually have a long way to go. For maybe when the issue of COVID-19 started, I think that's when I can say that the issue of transmitting data by the Federal Ministry of Health at NCDC, the Nigerian Center for Disease Control, well, maybe that one is peculiar because of the situation at hand. But for a patient, in terms of transmitting his health records or medical records to other countries, we actually have a long way to go, because that is what we still need to work on. Because globally, what we are talking about is mobile health. We are talking about artificial intelligence, machine learning, where we can be able to transmit their information by monitoring their data through personal digital assistants. We have other wireless devices and public health. And that's one of the problems we actually have in Nigeria. We don't have system in place. Even in some of the hospitals we still have this in silos. We still have files that are being carried from one place to the other. And in situation when some patient even comes a time, we have problem in even getting the actual information of the patient. They may even say the file is missing. The patient, they will have to get one paper again to start documenting the present information. So that is the challenge we are still having in India. But I think the country will still need to work on that to see that we need to embrace what we call electronic data monitoring. And that is what we have in abroad, like US, even in some other countries like Canada. We have electronic data monitoring where people information can be transmitted from one point to the other in the cyberspace.
Okay. Thank you, doctor. And I want to say thank you for that again. And now you are studying health and biomedical informatics currently in the US. What is that health biomedical informatics, and how will it benefit healthcare system in Nigeria? I need you to tell our viewers.
When we are talking about biomedical informatics, it involves an integration of computers, software tools, and databases in an effort to address biological questions. Biomedical informatics approaches are often used for major initiatives to generate large data sets. Besides that, when we are talking about biomedical informatics, we're quite aware that Nigeria is next to India in terms of one of the worst mortality and childhood indicators. But with biomedical informatics, the technology will help us to reduce child mortality through birth defects and genetic disorders that can be deadly to infants by early detection of these disorders so that they could be treated before they become fatal. And another information about biomedical informatics is that when we are talking about doing life science research, there are 3 ways it can be engaged. We have what we call in vitro experiments. The second one is in vivo experiment, and the third one is in silico. For example, when I'm talking about in vitro experimentation, that is the experimentation performed outside the living organism. The second one is in vivo, is the one that is done within the organism itself. Now, the third one is what is related to biomedical informatics, that is in silico. These are scientific experiments such conducted or produced by means of computer modeling or simulation. Because most of our genes or genetic research, most of it today, it is through computer simulations. And that is what is in vogue if you want to get solution to the problems that are plaguing most of our genetic disorder today. So that is why biomedical informatics comes in.
Sorry, we have to let our, our guests leave at this time because of our time. So I want to bring back our health talk. If we still have time, I want to bring back right now. I think our YouTube is messing up the day, so I want to apologize for what happened before. Please accept my apology. And we've talked about last week was our impact of wow, I have to do this. Don't know what's wrong with this. Sorry about. I'm not sure if you can hear me. Can you hear me? All right. Sorry about that. I have to do this. It's I don't know. I guess the YouTube is messing it up today. So let's quickly run through our head talk. If we can still do that, we'll do that. Last week was impact of climate change on human health. Today, we want to talk about tuberculosis. And what is tuberculosis? What is the signs? What is the causes? What is the treatment? That's what we're going to talk about shortly. And please, please, please stay with us. It's going to take us a little bit more time today. You just have to be with us today. What is tuberculosis? It's a contagious disease. It's a disease that is very deadly. Please, please take note of this. It's different from asthma. Asthma is not contagious. Tuberculosis is. So it's a potentially serious infectious disease that mainly affects our lungs. And this bacteria cause a bunch of health problems in your body once you have this tuberculosis. So these bacteria that cause tuberculosis are spread from person to person through a tiny droplet released into the air. There are coughs and sneezes. So you have to be very careful when you are dealing with people in sharing cutleries, lip gloss, anything that's going to have fluid in it. Please be very careful because it's a contagious disease. And let's quickly run through the causes of tuberculosis. Now, we say that it's a deadly disease. So tuberculosis is caused by a type of bacterium called Mycobacterium tuberculosis. And what is Mycobacterium? It's a genus of Actinobacteria. And this genus includes pathogens to cause serious disease in mammals, including tuberculosis itself and leprosy in humans. And the study also shows that there is no symptoms for this deadly disease. And most people infected with this bacteria cause tuberculosis don't usually have symptoms at all. So that is why you have to be very careful. If somebody is carrying this disease and you are sharing spoons, you're sharing everything that goes into that mouth of the person, you might probably be infected with this. So these are the symptoms that you can probably see with people having this infectious disease. The number one is cough. If the person is coughing more than 3 weeks, or is losing appetite, or having unintentional weight loss, fever, chill, or night sweats, you are at risk of tuberculosis. Please see your doctor immediately. It's very, very important. And let's look at the treatment. The treatment is not always required for those without symptoms, but the patient or anyone with active symptoms will require a long course of treatment involving multiple antibiotics. So if you have an active tuberculosis disease, you will probably be treated with a combination of antibacterial medication for period of 6 to 12 months. And the most common treatment for this active tuberculosis is isoniazid, INH, in combination with 3 other drugs. And what are these drugs? Rifampicin, pyrazinamide, and entadol. These 3 medications are for tuberculosis. If anybody is giving you this and it's different from the disease that I mentioned, please ask questions. It's very important you do that. Now, let's look at our key takeaway. Let's recap all we have done, because our key takeaway, important things we must remember are coming from what we just discussed. So let's not forget the following fact. Number 1, tuberculosis is a serious infectious disease that only affects our lungs. It also spread when a person with this disease in their lungs coughs or sneezes, and someone next to you will inhale it, and that's it. Once you inhale it, you got it. So tuberculosis don't really have symptoms, but when you have it, symptoms like cough, like night sweats, fever, chills that last more than 3 weeks, you must see your doctor immediately. Lastly, don't share things with people. It is very important. Things like cutlery, toothbrush, lip gloss, please don't share with people. Even if you don't know that the person is having this disease, don't share. It is not even hygienic to be sharing toothbrush, spoons, if it's not washed. I mean, the spoons, the cutleries, even the lip gloss. If you go to the stores, they don't, if you are doing the testing, you will not see them allow you to put that thing inside it and put it in on your lips. No, they will give you sticks to dip into that lip gloss and put on your lips because they want to prevent you. We don't know who is carrying this disease. Please, please, and please be very careful of that. Right now, we're going to jump right into our nutrition segment. We won't be able to do any other break, but let's go down to our nutrition segment because of our time. We just discussed about tuberculosis. What do we do? What are the food we can be eating or we must be eating if we have this disease? These are the food you must be eating if you have tuberculosis. You must be on calorie-dense food. What are these food? Banana, cereal porridge, or peanut, wheat, and so on. Now, let me break it down for you if you are on calorie dense. If I say calorie dense, I mean that all the food that have high calories, you will always be on this. You can't eat anything that's going to aggravate your lungs to start coughing. No, you can't do it. You cannot do it. Please be careful. You also want to be on protein-rich food, which increase your immune system. So you want to be on dry fruits, granite. You want to be on milkshake. You want to be on eggs. You want to be on tofu, on soy, and so on. You also want to be on vitamin A, E, and C. Some of the best food for this vitamin A, E, and C are mango, papaya, sweet pumpkin, carrots, orange, and so on. These are the food you must be on. And it is very, very important you stick to your vitamin A, E, and C, protein-rich foods, and also your calorie-dense food. It is very, very important. Now, I want to advise on this particular tuberculosis because it gives me more concern because it is a very deadly disease. If you see anybody next to you and they are coughing and you realize, seriously, one of the symptoms of COVID-19 is cough, right? And you quickly give attention to that person. Oh, it's COVID-19 patient, something like that. No, it is not only for COVID-19. Anyone with tuberculosis will cough. And how do you know it is tuberculosis? There's no way you can know that because most of the people that carry this disease, they don't have enough strength to be going around. And you will also see signs that they have it. And when you see this sign, please and please just walk away. If these people or the patient is somebody you cannot avoid, always cover your mouth, your nose, and don't share things with the patient that carry this disease. Honestly, it is the disease that you cannot cure. Once you have it, that is it. Nothing to do to it. They just make, they administer medication on the patient regularly so that it keeps them going, keep them alive. So there is no reason to be ignorant of this. And for ladies, you want to be kissing everybody around you. For those that are just getting the infection, the virus, they have not been diagnosed that they have the infection, and you want to put your mouth on anybody that you see, you have to be very careful. Same thing goes to all men too. You want to be careful. Our guest mentioned hepatitis. You can get this virus from kissing too. And also HPV, because there are some diseases that we ignore and we focus on COVID-19. No, HPV, it's also a very serious infection. A very serious infection that you contact through sex, from your partner. So the vaccine has been given to all the ages now, except the younger ones. They have, once you are in high school, I think in high school and middle school, from middle school to high school and adults, they have to take this vaccine, HPV. Because if it's not taken care of on time and you are diagnosed of this, it can lead to cancer, cervical cancer or uterus cancer, whatever cancer a woman can have. Men can also have it too. So we have to be very careful what to eat, who to relate with, things to put on our body, in our mouth. It is very important we do this. So I want to say thank you so much for joining us today. Again, I want to apologize for all the audible problems that we have on the program today. I'll work on it. I apologize for that. So I want to thank everyone for joining us today, those that joined us for the first time, and those that are the returning viewers. Thank you so much for your love. And I want you to visit our social media handles, Instagram, Healthy Living with Bofa. Our Facebook is Bofa Live Healthier. And our website is www.hlwbofa.com, or just type healthylivingwithbofa.com. It takes you right there. And our number, you can reach out to us. The reason why we want you to reach out to us is a lot of problems are going on and many people are suffering underneath. I've received many calls and I've reversed so many diseases through diet. Not all the problem, not all the health problem that require surgery, that require medication or any procedure. Some people need to work on their diet, on what they put into this mouth. So, and we have been receiving calls with many cases like that, and they have been giving testimony. If you have any problem, I'm not the only one doing it. I have other experts, medical practitioners that if I can't, I consult them. So if you have opportunity to have our number and you have any problem, please don't hesitate to reach out to us. That is why we, always tell you how to contact us. And if you want to reach us on the number, US number is +1 917 889 6854 for any inquiry, even advert, promotion, health-related issues or questions. Please and please don't keep quiet. Open your mouth and talk. Don't spend thousands tomorrow on what you can spend ₦5 or $5 on today. Things you can just work on with the food, with all this seasoning you have in your food storage. Don't ignore it. They are very medicinal and they work for us. I do the same thing. I don't go to the hospital unless I want to go for my checkup. That's it. So I've been careful of what I eat and what I apply on my body and what things I do. And I want you to do the same. Coming online every time to tell you this, it's not a joke. I've seen thousands of people dying of little things, little health problem that can be taken care of with little things, like the food you need to change. So why are we ignorant of this? So we are advocating on healthy living, wellness in all areas of life. That is what everybody is advocating for. So please and please don't hesitate to join us, to call us anytime, any day. The number is available 24 24 hours. And the number again is +1 917 889 6854. My best friend always says to me, beautiful and sweet words every day we talk over the phone. And I'm going to share some with you today, those sweet words that we always share together. My friend says, Betty, life brings good and bad, but goodness is constant. We are only sure of one life, and that is it. Let's make the best of it. Enjoy each moment and let life, each day, treat you well, and live each day well. Are you living your life well? Are you living that day well? Answer yourself that. As for me and my friend, we are trying our best to live each day well. Once again, I want to say thank you so much for broadcasting with us today. God bless you all. I'm Betsy Olayinka Folarin Akinsola, aka Bofa, advocating on health and wellness from Healthy Living with Bofa TV. Until next week, we see and we come back on this show. Stay safe and live your healthiest life. Please continue to stick with us on Healthy Living with Bofa for more information on health and wellness. I will see you next week by God's grace. I leave you with this. So stay safe and be healthy. See you next week. Bye.